Question 1. A social worker receives a referral for a 16-year-old client who has recently been hospitalized for an overdose and is now refusing to engage in therapy. The client's parents are desperate for her to receive help. What is the first action the social worker should take? A. Schedule a family therapy session to address the client's resistance. B. Consult with the referring hospital staff for more information about the overdose. C. Attempt to establish rapport with the client in an individual session. D. Obtain a signed release of information from the parents to speak with the client. Answer: C. Attempt to establish rapport with the client in an individual session. The concept tested here is the initial engagement with a resistant minor client, especially after a crisis. Although gathering information and involving parents are important, the keyword first emphasizes the immediate priority, building a connection directly with the client. Establishing rapport in a safe, individual space is crucial for trust, which is the foundation for any successful intervention, particularly when the client is mandated or resistant, much like a first meeting where you aim to build trust before diving into problems. Remember, before you can help someone, you must connect with them on their terms. Question 2. A social worker is conducting an initial assessment with an adult client who reports experiencing significant anxiety and panic attacks following a recent job loss. The client also mentions difficulty sleeping and a lack of appetite. What is the best initial focus for the social worker? A. Exploring the client's employment history and financial stressors. B. Collaborating with the client to develop coping strategies for anxiety. C. Conducting a comprehensive mental status examination. D. Assessing for any immediate safety concerns or suicidal ideation. Answer: D. Assessing for any immediate safety concerns or suicidal ideation. This question addresses the critical initial steps in an assessment, particularly when a client presents with significant distress. The key phrase, best initial focus, directs the social worker to prioritize safety above all else. While exploring stressors, developing coping strategies, and conducting a mental status exam are all vital components of a comprehensive assessment, the immediate and paramount concern when symptoms like difficulty sleeping and lack of appetite accompany significant anxiety and a life stressor is always to rule out any potential for self-harm. Always remember that client safety is the absolute top priority in any social work intervention. Question 3. A social worker is facilitating a support group for survivors of domestic violence. During a session, one member, who has been consistently quiet, suddenly becomes visibly agitated and begins to cry uncontrollably while another member is sharing. What is the most appropriate immediate action for the social worker? A. Gently ask the crying member if she needs to take a break from the group. B. Continue to allow the sharing member to speak, providing a tissue to the crying member. C. Redirect the discussion to a less emotionally charged topic. D. Validate the crying member's emotions and acknowledge her distress in the group. Answer: D. Validate the crying member's emotions and acknowledge her distress in the group. This question tests the social worker's ability to manage emotional intensity in a group setting. The keyword most appropriate immediate action emphasizes the need for a response that maintains safety and validates feelings within the group context. While offering a break might seem helpful, immediately validating the member's emotions models empathy and normalizes her response for the entire group, fostering a supportive environment without singling her out or shutting down the current discussion prematurely. For example, saying, "I see this is a very difficult topic for you, and it's okay to feel these emotions here," can be incredibly powerful. Always remember that acknowledging and normalizing feelings in a group often strengthens the group's cohesion and therapeutic potential. Question 4. A social worker is working with a family where the parents are struggling to set consistent boundaries with their 8-year-old child, leading to frequent temper tantrums and defiance. The child is otherwise thriving in school. What is the best intervention strategy for the social worker to employ? A. Refer the child for individual play therapy to address behavioral issues. B. Provide psychoeducation to the parents on effective parenting techniques and boundary setting. C. Conduct a family session to explore the underlying dynamics contributing to the child's behavior. D. Advocate for the child to be placed in an after-school program with more structured activities. Answer B. Provide psychoeducation to the parents on effective parenting techniques and boundary setting. This question focuses on identifying the most direct and effective intervention for a common parenting challenge. The keyword best intervention strategy suggests looking for an approach that directly addresses the identified problem in the most impactful way. Since the core issue is the parents' struggle with boundary setting, equipping them with knowledge and skills through psychoeducation is the most direct and empowering way to create change within the family system, often leading to improved child behavior. For example, teaching parents about positive reinforcement and consistent consequences can significantly reduce tantrums. The best way to help a child with behavioral issues often involves helping the parents learn new skills. Question 5. A social worker is conducting a home visit and observes that the client's living conditions are unsanitary, with strong odors and excessive clutter. The client, who lives alone, appears disheveled and reports feeling overwhelmed but insists they are managing fine. What is the next step the social worker should take? A. Contact Adult Protective Services, APS, to report potential self-neglect. B. Help the client begin to clean and organize their living space immediately. C. Express concern for the client's well-being and discuss the observed living conditions gently. D. Schedule a follow-up visit to reassess the living conditions after a week. Answer C. Express concern for the client's well-being and discuss the observed living conditions gently. This question tests the social worker's ability to address concerns about a client's living conditions while maintaining rapport and respecting autonomy. The keyword next step implies that while action is needed, it should follow a logical, client-centered progression. Before escalating to APS or directly intervening with cleaning, the social worker must engage the client in a conversation about their observations, express concern, and assess their perspective and capacity, which upholds the principle of client self-determination. This is similar to gently asking a friend if they need help rather than immediately taking over their chores. Always prioritize open communication and assessment of the client's willingness and capacity before making external referrals or taking direct action. Question 6. A social worker is meeting with a 45-year-old male client who reports feeling increasingly isolated and depressed after his children left for college and his wife recently passed away. He states, "I just don't see the point in anything anymore." What is the first priority for the social worker? A. Explore the client's grief process and coping mechanisms. B. Connect the client with community bereavement support groups. C. Assess the client for suicidal ideation and intent. D. Develop a plan for increasing the client's social engagement. Answer C. Assess the client for suicidal ideation and intent. This question addresses crisis intervention and safety planning. The phrase "first priority" strongly indicates that immediate safety concerns must be addressed before anything else. The client's statement, "I just don't see the point in anything anymore," especially in the context of significant loss and depression, is a direct red flag that requires an immediate and thorough assessment for suicidal thoughts, plans, and intent. This is always the most critical initial step when there's any hint of harm to self or others, much like checking a smoke detector before investigating a strange smell. Remember, when in doubt about safety, always assess first. Question 7. A social worker is facilitating a parenting skills workshop. During a discussion, a participant makes a derogatory comment about another culture's parenting practices. What is the best way for the social worker to respond? A. Ignore the comment and redirect the conversation back to the workshop material. B. Challenge the participant directly, stating that the comment is inappropriate and offensive. C. Acknowledge the comment and facilitate a discussion about cultural differences in parenting, emphasizing respect. D. Ask the participant to leave the workshop for making an offensive statement. Answer: C. Acknowledge the comment and facilitate a discussion about cultural differences in parenting, emphasizing respect. This question tests the social worker's ability to manage group dynamics and address sensitive issues like cultural insensitivity in a constructive manner. The keyword best way points to a response that upholds ethical principles while promoting learning and inclusivity. Directly challenging or ignoring the comment might shut down dialogue, but acknowledging it and then opening a respectful discussion about cultural differences allows for education, broadens perspectives, and models appropriate behavior for the group without shaming the individual. For instance, explaining how different cultures might prioritize values like independence versus interdependence in child rearing can be illuminating. The most effective approach is to turn a teachable moment into an opportunity for growth and understanding. Question 8. A social worker is working with a client diagnosed with schizophrenia who has been consistently missing their medication appointments and experiencing a worsening of symptoms. The client states they don't believe the medication helps and dislikes the side effects. What is the most important immediate goal for the social worker? A. Educate the client about the importance of medication adherence for symptom management. B. Collaborate with the client and their psychiatrist to explore medication alternatives or adjustments. C. Emphasize the potential for rehospitalization if medication is not taken as prescribed. D. Arrange for a family meeting to enlist their support in ensuring medication adherence. Answer: B. Collaborate with the client and their psychiatrist to explore medication alternatives or adjustments. This question addresses medication adherence and client autonomy in the context of a severe mental illness. The keyword most important immediate goal points to a client-centered and collaborative approach. While education and family involvement are relevant, the client's direct report of disbelief in medication efficacy and dislike of side effects highlights the need for immediate action that respects their experience and addresses their concerns. Collaborating with the client and their psychiatrist to find a suitable medication regimen, whether through adjustment or alternatives, directly tackles the barriers to adherence and empowers the client in their treatment. This is like working with a patient to find a pain medication that works for them without too many side effects, rather than just telling them to take what's prescribed. Always empower the client in their treatment decisions whenever possible, especially when adherence is an issue. Question 9. A social worker is preparing to terminate services with a client who has achieved their therapeutic goals. The client expresses sadness about ending therapy and asks if they can stay in touch socially after termination. What is the next action the social worker should take? A. Gently remind the client of professional boundaries and the ethical guidelines regarding dual relationships. B. Acknowledge the client's feelings of sadness and discuss the natural feelings of loss associated with termination. C. Agree to an occasional, brief social interaction to ease the transition for the client. D. Refer the client to another social worker for continued support to address their feelings of loss. Answer: B. Acknowledge the client's feelings of sadness and discuss the natural feelings of loss associated with termination. This question tests the social worker's ability to navigate the termination phase of therapy, particularly when a client expresses attachment. The keyword next action suggests that while ethical boundaries are crucial, the immediate focus should be on the client's emotional experience. Before directly stating ethical rules, it is essential to acknowledge and normalize the client's feelings of sadness and loss, as this validates their experience and helps them process the ending of the therapeutic relationship in a supportive way. For example, you might say, "It's completely normal to feel sad when ending something that has been important to you." Always prioritize validating the client's emotions before setting firm boundaries, as it helps maintain rapport and facilitates a healthier termination process. Question 10. A social worker in a community mental health clinic is tasked with developing a new program to address the rising rates of substance use among young adults in the area. What is the first step the social worker should take in program development? A. Secure funding and resources for program implementation. B. Identify evidence-based interventions for substance use prevention and treatment. C. Conduct a comprehensive needs assessment to understand the specific issues and resources in the community. D. Assemble a team of professionals to staff the new program. Answer: C. Conduct a comprehensive needs assessment to understand the specific issues and resources in the community. This question focuses on the initial stages of program development in a community setting. The keyword first step highlights the foundational principle of starting any new program with a thorough understanding of the problem and the community it intends to serve. A needs assessment involves gathering data to identify the specific nature of substance use in young adults, existing services, and community resources, which ensures the program will be relevant, effective, and tailored to the target population. For instance, without a needs assessment, a program might offer services that young adults don't want or can't access. Always begin program development by truly understanding the needs and context of the community you aim to serve. Question 11. A social worker receives a subpoena to release a client's records in a legal proceeding. The client has not provided consent for the release of information. What is the best action for the social worker to take? A. Immediately release the records as mandated by the subpoena. B. Contact the client to discuss the subpoena and seek their informed consent. C. Consult with agency legal counsel regarding the validity and scope of the subpoena. D. Inform the court that the records cannot be released due to client confidentiality. Answer: C. Consult with agency legal counsel regarding the validity and scope of the subpoena. This question addresses the complex ethical and legal obligations of a social worker when faced with a subpoena. The keyword best action emphasizes the need for a response that protects client rights while adhering to legal requirements. While client consent is preferred and confidentiality is paramount, a subpoena is a legal order. Therefore, the best first step is to seek legal counsel to determine the subpoena's validity, scope, and any potential for challenging it, ensuring the social worker navigates the situation ethically and legally without prematurely releasing records or overstepping their authority. This is similar to needing a lawyer to interpret a legal document before you act on it. Always consult legal counsel when a subpoena for client records is received to ensure proper adherence to both legal mandates and ethical principles. Question 12. A social worker is conducting a biopsychosocial assessment for a 30-year-old client seeking services for chronic depression. The client reports a history of trauma, including childhood abuse, but expresses a strong desire to focus only on current symptoms and not discuss past experiences. What is the most appropriate approach for the social worker? A. Respect the client's stated preference and focus on current symptoms and coping strategies. B. Gently explain the importance of exploring past trauma in understanding current depression. C. Suggest that the client might benefit from a referral to a trauma-informed therapist. D. Document the client's reluctance to discuss trauma and proceed with the assessment as planned, noting the omission. Answer. A. Respect the client's stated preference and focus on current symptoms and coping strategies. This question emphasizes client self-determination and pacing in the therapeutic process. The keyword "most appropriate approach" guides the social worker to prioritize the client's readiness and comfort. While trauma is relevant to depression, pushing a client to discuss painful past experiences before they are ready can be re-traumatizing and damage the therapeutic relationship. Respecting their stated preference, even if it means initially limiting the scope of discussion, empowers the client and builds trust, which may eventually lead to a willingness to explore trauma. For example, if someone expresses discomfort discussing a sensitive topic, you respect that boundary and work within it. Always honor the client's readiness and autonomy in setting the pace for disclosure, especially concerning trauma. Question 13. A social worker is facilitating a session with a couple experiencing frequent arguments and communication breakdowns. During the session, one partner consistently interrupts the other, dismisses their feelings, and raises their voice. What is the best intervention for the social worker to use in this moment? A. Directly confront the interrupting partner about their disrespectful communication style. B. Reflect the feelings of the partner who is being interrupted and validate their experience. C. Implement a structured communication exercise to give each partner equal speaking time. D. Pause the discussion and educate both partners on active listening skills. Answer. C. Implement a structured communication exercise to give each partner equal speaking time. This question focuses on managing problematic communication patterns in couples therapy. The keyword "best intervention" in this moment suggests an action that immediately addresses the observed dysfunctional behavior to create a more productive therapeutic environment. While validating feelings and educating on active listening are important, directly implementing a structured communication exercise, like using a talking stick or setting clear turn-taking rules, provides an immediate and tangible boundary against the interrupting behavior, allowing both partners to feel heard and fostering a more equitable dialogue. This is similar to a referee pausing a game to enforce a rule when a player is unfairly dominating. When communication is breaking down, sometimes the most effective approach is to introduce a structure that forces healthier interaction. Question 14. A social worker is working with an adolescent client who has been diagnosed with major depressive disorder and has a history of self-harm. The client's parents are divorced and have conflicting views on treatment, often undermining each other's efforts to support their child. What is the next step for the social worker? A. Advocate for the client's parents to attend co-parenting counseling. B. Focus on individual therapy with the adolescent to provide a consistent support system. C. Conduct a family session with both parents and the client to establish a unified treatment plan. D. Educate the parents individually about the importance of a consistent approach to their child's care. Answer. C. Conduct a family session with both parents and the client to establish a unified treatment plan. This question highlights the impact of parental conflict on a child's mental health treatment. The keyword "next step" points to addressing the immediate systemic barrier to the client's progress. While individual education or co-parenting counseling might be considered later, the most direct way to mitigate the conflicting views and ensure consistent support for the depressed adolescent is to bring all key parties together in a family session to collaboratively develop a unified treatment plan. This ensures everyone is on the same page, much like a team meeting to ensure all members understand their roles in a project. Creating a shared understanding and plan among the parents is crucial for the client's stability and progress. Question 15. A social worker is providing grief counseling to a client whose spouse recently died suddenly. The client is experiencing intense feelings of guilt, anger, and sadness, and reports difficulty performing daily tasks. What is the most important aspect for the social worker to focus on in the initial sessions? A. Helping the client understand the stages of grief. B. Normalizing the client's intense emotional reactions to loss. C. Encouraging the client to seek support from friends and family. D. Developing a new routine for the client to help with daily functioning. Answer: B. Normalizing the client's intense emotional reactions to loss. This question addresses supporting a client in acute grief. The phrase "most important aspect" in the initial sessions suggests prioritizing immediate emotional validation and support. When a client experiences intense and overwhelming emotions after a sudden loss, their feelings can feel frightening or abnormal. Normalizing these reactions helps to reduce their distress, validate their experience, and assure them that their feelings are a natural part of the grieving process, which is foundational for building trust and allowing them to fully express themselves. For instance, explaining that guilt and anger are common grief responses can be immensely comforting. Always focus on validating and normalizing a grieving client's feelings first, as this creates a safe space for healing. Question 16. A social worker is leading a psychoeducational group for individuals recently diagnosed with generalized anxiety disorder. A new member joins and immediately expresses skepticism about the group's effectiveness and repeatedly interrupts others. What is the first thing the social worker should do? A. Address the member's skepticism directly by highlighting the group's past successes. B. Politely remind the member of the group rules regarding respectful listening and participation. C. Acknowledge the member's feelings and invite them to share their concerns about the group. D. Pair the new member with a more experienced, supportive group member to guide them. Answer: C. Acknowledge the member's feelings and invite them to share their concerns about the group. This question tests the social worker's skill in managing challenging group dynamics, particularly with a resistant new member. The keyword "first thing" points to an initial response that aims to understand and engage the member rather than immediately correcting their behavior. Acknowledging their skepticism and inviting them to share their concerns validates their experience, reduces defensiveness, and opens a pathway for them to feel heard and potentially integrated into the group. This is similar to asking someone why they're hesitant before telling them they're wrong. Always try to understand the underlying feelings or concerns of a resistant group member before implementing rules or offering solutions. Question 17. A social worker is working with a client who is experiencing homelessness and chronic unemployment. The client expresses feelings of hopelessness and states they have given up trying to find work or housing. What is the best way for the social worker to empower this client? A. Provide the client with a list of housing shelters and job search resources. B. Focus on exploring the client's strengths, skills, and past successes, however small. C. Advocate on the client's behalf by directly contacting potential employers and landlords. D. Facilitate a discussion about the systemic barriers that contribute to homelessness and unemployment. Answer: B. Focus on exploring the client's strengths, skills, and past successes, however small. This question is about empowering a client experiencing extreme hopelessness. The keyword "best way to empower" directs the social worker to an approach that builds on the client's internal resources. While practical resources and advocacy are important, helping a client who feels they have given up to identify and connect with their own strengths, skills, and past achievements, even minor ones, directly combats feelings of hopelessness and can reignite a sense of agency and self-efficacy. This is like reminding someone of all the challenges they've overcome, which can give them the courage to face new ones. Always start by identifying and building on a client's strengths to foster empowerment, especially when they feel defeated. Question 18. A social worker is assigned to a client who has been court-ordered to attend anger management classes after a physical altercation. In the first session, the client expresses extreme anger about being mandated to attend and blames the victim for the incident. What is the most important initial goal for the social worker? A. Help the client identify triggers for their anger. B. Educate the client about the consequences of their actions. C. Establish rapport and explore the client's perception of the court order. D. Challenge the client's blaming behavior and promote accountability. Answer: C. Establish rapport and explore the client's perception of the court order. This question addresses engaging a mandated and resistant client. The phrase "most important initial goal" emphasizes the foundational work needed before any direct intervention. When a client is mandated and expresses strong resistance and blame, the first and most crucial step is to establish rapport and understand their perspective on the situation and the court order. This doesn't mean agreeing with them, but it allows the client to feel heard and respected, which is essential for overcoming resistance and creating an environment where future therapeutic work can occur. This is like building a bridge before you can cross a river. Without initial rapport and understanding, attempts to challenge or educate will likely be met with further resistance. Question 19. A social worker in private practice discovers that a new client shares the same uncommon last name and hometown as a former client with whom the social worker had a particularly challenging therapeutic relationship. The social worker feels a sense of unease. What is the best action for the social worker to take? A. Proceed with the assessment, remaining vigilant for any signs of countertransference. B. Discuss the potential for a dual relationship or conflict of interest with the new client. C. Consult with a supervisor or colleague about the situation and potential ethical implications. D. Refer the new client to a different social worker to avoid any perceived conflict. Answer: C. Consult with a supervisor or colleague about the situation and potential ethical implications. This question tests ethical decision-making, specifically regarding potential conflicts of interest, dual relationships, and countertransference. The keyword "best action" directs the social worker to a proactive, ethical, and protective step. While proceeding with caution might seem plausible, the best practice is to consult with a supervisor or trusted colleague. This allows for an objective perspective on whether the perceived connection or the social worker's unease creates a real or potential ethical conflict, or if it's simply countertransference that can be managed, ensuring the client's best interests are prioritized. It's like having a second pair of eyes review a difficult decision. Always seek consultation when faced with potential ethical dilemmas or strong personal reactions that could impact client care. Question 20. A social worker is conducting an intake with a young adult client, 22 years old, who identifies as transgender. The client expresses feeling invalidated by their family and struggles with finding affirming healthcare providers. What is the most important consideration for the social worker during this initial assessment? A. Focus on gender identity exploration and potential for gender-affirming care referrals. B. Assess for potential mental health concerns such as depression or anxiety. C. Use the client's preferred name and pronouns consistently and respectfully throughout the interaction. D. Educate the client about legal protections and advocacy resources for transgender individuals. Answer: C. Use the client's preferred name and pronouns consistently and respectfully throughout the interaction. This question emphasizes culturally sensitive and affirming practice, particularly with transgender clients. The phrase, most important consideration during this initial assessment points to the fundamental step in establishing a safe and validating therapeutic environment. Before delving into specific interventions or assessments, consistently using the client's preferred name and pronouns is a powerful act of respect and affirmation that communicates acceptance and creates trust, which is crucial for building rapport with a client who has experienced invalidation. This is like addressing someone by their chosen name and title. It's a basic sign of respect. Always prioritize affirming a client's identity through respectful language as the foundation for all other therapeutic work. Question 21. A social worker in a hospital setting is working with a 70-year-old client who has just received a terminal cancer diagnosis. The client's adult children are demanding that the social worker keep the diagnosis a secret from their mother, believing it will cause her too much distress. The client has not explicitly stated her wishes regarding the information. What is the first action the social worker should take? A. Educate the children about the client's right to self-determination and truth-telling. B. Facilitate a family meeting to discuss the implications of withholding information. C. Assess the client's capacity to make informed decisions about her medical care and information. D. Consult with the medical team about the ethical implications of the children's request. Answer, C. Assess the client's capacity to make informed decisions about her medical care and information. This question involves a complex ethical dilemma concerning client autonomy and the wishes of family members in end-of-life care. The keyword first action directs the social worker to the foundational principle that precedes all other considerations, determining the client's ability to participate in decisions about their own life. Before any discussions with the family or medical team about disclosure, the social worker must assess the client's cognitive and emotional capacity to understand her diagnosis and make informed choices, as her right to self-determination is paramount if she has capacity. This is akin to checking if an individual is of sound mind before acting on behalf of someone else. Always prioritize assessing the client's capacity for self-determination when their autonomy is potentially compromised or being challenged. Question 22. A social worker is conducting an in-home visit with a single mother and her 2 young children. The mother reports feeling overwhelmed and states she sometimes snaps at her children due to stress, though she denies any physical abuse. The children appear well cared for. What is the next step for the social worker? A. Offer parenting classes to help the mother manage stress and discipline. B. Conduct a thorough safety assessment, including exploring the mother's snapping behaviors further. C. Provide information about respite care or support groups for single parents. D. Develop a safety plan with the mother to prevent any future incidents of snapping. Answer, B. Conduct a thorough safety assessment, including exploring the mother's snapping behaviors further. This question involves assessing potential child welfare concerns based on a parent's self-disclosure. The keyword next step emphasizes the immediate need to ensure child safety. While the children appear well cared for, the mother's admission of snapping at them due to stress, combined with the phrase denies any physical abuse, raises a red flag that requires further exploration to ensure there is no unacknowledged or potential for harm. A thorough safety assessment, which involves deeper questioning about the nature and frequency of these snaps and their impact, is crucial before offering other interventions. This is similar to investigating a small fire before trying to put it out. Always prioritize a comprehensive safety assessment when there is any indication of potential harm to children. Question 23. A social worker is working with an elderly client who lives alone and has recently experienced a fall. The client is recovering well physically but expresses fear about falling again and has become increasingly socially isolated, refusing to leave her home. What is the best intervention to address the client's fear and isolation? A. Encourage the client to move into an assisted living facility for increased safety and socialization. B. Connect the client with a home health aide to assist with daily tasks and provide companionship. C. Facilitate a discussion with the client about her fears, exploring strategies to regain confidence and re-engage in activities. D. Refer the client to a physical therapist to improve balance and reduce the risk of future falls. Answer: C. Facilitate a discussion with the client about her fears, exploring strategies to regain confidence and re-engage in activities. This question focuses on empowering an elderly client to overcome fear and social isolation following a fall. The keyword best intervention points to a client-centered approach that directly addresses the psychological barriers. While physical therapy and home health aides address aspects of the problem, the client's fear and subsequent isolation are primarily psychological. Engaging her in a discussion to explore her fears and collaboratively develop strategies to regain confidence and re-engage, e.g., small, manageable steps like walking to the mailbox, empowers her self-determination and helps her overcome the emotional impact of the fall. This is like helping someone overcome a fear of driving after an accident by gradually reintroducing them to the road. Always prioritize addressing the client's emotional and psychological barriers to independence and engagement. Question 24. A social worker is conducting a psychosocial assessment for a client who reports experiencing flashbacks and nightmares related to a past traumatic event. The client becomes visibly distressed and begins to dissociate during the session. What is the first action the social worker should take? A. Gently reorient the client to the present moment and the safety of the therapy room. B. Document the dissociative episode and continue with the assessment after a brief pause. C. Encourage the client to describe the details of the traumatic event to process it. D. Refer the client immediately to a psychiatrist for medication management. Answer: A. Gently reorient the client to the present moment and the safety of the therapy room. This question addresses managing a client's dissociative response during a session, particularly in the context of trauma. The keyword first action highlights the immediate priority of ensuring the client's safety and stability. When a client dissociates, they become detached from reality, and continuing with the assessment or pushing for details can be re-traumatizing. The most immediate and critical step is to gently and calmly reorient them to the present moment and the safety of the therapy environment, helping them ground themselves before any further therapeutic work can occur. This is like gently waking someone from a nightmare and assuring them they are safe. Always prioritize grounding and reorientation techniques when a client dissociates to help them regain a sense of safety and presence. Question 25. A social worker is working with a teenager who frequently engages in cyberbullying. The teenager's parents are unaware of their child's online behavior. What is the most ethical course of action for the social worker? A. Maintain confidentiality and work with the teenager in individual therapy to address the behavior. B. Break confidentiality and inform the parents immediately about the cyberbullying. C. Obtain the teenager's consent to discuss the cyberbullying with their parents. D. Facilitate a family session to help the teenager disclose their behavior to their parents. Answer: D. Facilitate a family session to help the teenager disclose their behavior to their parents. This question presents an ethical dilemma involving confidentiality with a minor, potential harm, and parental involvement. The phrase "most ethical course of action" guides the social worker to a solution that balances client autonomy, potential harm, and the need for parental support. While breaking confidentiality might seem like an option for safety, and individual therapy is important, the most ethical and empowering approach is to work with the teenager to facilitate their disclosure to their parents in a controlled, supportive family session. This respects the teenager's autonomy as much as possible, helps them take responsibility, and engages the family in finding a solution, which is crucial for lasting change. This is similar to helping someone practice what they need to say before having a difficult conversation. Always aim to empower the minor client to involve their parents in sensitive issues when it is in their best interest and does not pose undue harm.